Hello everyone and welcome to Supplemental Sense. Today I'm going to be talking about prostate supplements. I feel like there's a lot of controversies and different opinions on what you should do if you have an enlarged prostate or even prostate cancer. This video is going to help show you ways in attaining normal prostate health naturally and avoiding those risky procedures and surgeries and taking medications that can have other side effects. So we've all seen the commercials on TV. It's no secret that more and more men are having issues with their prostate, whether it being benign prostatic hyperplasia or prostate cancer. BPH is the most common disorder. Half of the men over age 50 suffer from some symptoms of BPH, and as the age goes up, that percentage correlates with it. So 60% of men 60 and older are going to suffer from symptoms of BPH, and that pattern just continues. Prostate cancer is the second most common cancer for men, and it's the leading type of cancer deaths for men. So here are the conventional treatments. Alpha blockers is something that's been used for quite a long time. They found out that alpha blockers can cause eye problems and cataracts, so that's something you definitely don't want to take. 5-alpha reductase inhibitors. Now this is something that just blows my mind because this will actually lower your testosterone. But it has been shown to relieve symptoms for up to a year or two. But after that point, symptoms come back and a lot of times are much worse than before. But you can always choose to microwave your prostate. And this transurethral microwave thermal therapy, side effects of this procedure include painful urination and more urgency, frequent urination, and a lot of men have to have this procedure redone multiple times. And then there's the transurethral radiofrequency needle ablation. That sounds even better. This is going to have sort of the same side effects, and these side effects seem to be the things that we're trying to fix. So it really makes no sense to me why anybody would want to do these stupid procedures. And then there's the prosthetic stents, and this is something that is not usually done, but I've seen that these can even make your symptoms worse, and there's some worse side effects to this. And then you have the surgery, and that's probably the most risky of all. That can have the biggest consequences to it, and that would be like a last case scenario. But it's something that a lot of men opt in to do. So let's get into the root problem here. What's causing all of these prostate issues? And the main thing is low testosterone. And the medical community wants you to believe that the reason you have prostate problems is because you have high testosterone and you need to get it lowered. Well, if that were the case, then the only people that should have prostate issues should be teenagers, younger people, because they're the ones with the highest testosterone. Now what can be a problem is having too high of DHT levels, dihydrotestosterone, and having high estrogen levels. The medical community wants to start lowering these men's testosterone then, while they should be lowering the estrogens instead. Then you have all these other environmental factors like pesticides and GMO, things that are going to start increasing free radicals in the body. And then of course being deficient in alpha blockers. Wait a second. How did they get into my video? Ignore that one, please. So then we have the conventional supplements. These are the things that are most commonly used in alternative medicine. Saw palmetto being probably the king of all of them. But this is just another 5-alpha reductase inhibitor. This is something that's going to increase your free testosterone initially because it's blocking a conversion into DHT. And then you have testofen, or fenugreek extract, and that's just doing the exact same thing that saw palmetto does. Stinging nettles and pygeum are both actually really good for your prostate health, so I would recommend taking those. And then you have Crinum latifolium, which is an herb from Vietnam, and there's not a whole lot of evidence backing this one out there yet, so I couldn't really say for sure if this is something to take. We got beta-sitosterol. That's something that's going to lower your absorption of cholesterol and lower your cholesterol in the body. So that's only going to hurt testosterone levels, so I would not take that. Then you have lycopene. which to me doesn't really seem to do much either way. So if you want to try it, go ahead, but not a big one. And pumpkin seed extract does show some promise, so you could go with that one if you like. So now let's go into some other supplements, things that can raise your testosterone and lower your estrogen and actually help you make some progress. So things to raise your testosterone would be zinc or ZMA supplement. Creatine is always a good one. A few of the herbs like mucuna perine, tongkat ali, horny goatweed, coleus forscoli, and any sort of adaptogen herb, they're all going to be great. You can even try a D-aspartic acid supplement if you like. Then for lowering estrogen, I would suggest DIM. That's something that helps the liver metabolize more estrogens. Indole 3-carbinol is a precursor to that and may actually be more effective for some people. And then you have zinc, and zinc is an aromatase enzyme inhibitor. The aromatase enzyme will convert some testosterone into estrogens, so it's always great if you can have less of that going on. Resveratrol has been shown to do that same sort of thing. And then you have calcium D-glucarate, and that's something that can detoxify estrogen molecules in the body. Now some of the other supplements I would look for would be things like alpha-lipoic acid and L-glutathione, as those are great antioxidants to have. Vitamin C is great for the immune system. Vitamin D, a good one for testosterone. And make sure to get your omega-3s. Cod liver oil being my favorite one, as that has natural sources of vitamin A. Beef liver also has very good sources of real vitamin A. Then you have glandular supplements. These are kind of interesting. This is going to allow you to get actual prostate gland tissues into your body, and that may be beneficial in helping the healing process. So now let's go over the quality check. Be wary of prostate formulas, those proprietary blends. They're always going to have things in them like saw palmetto, fenugreek, any of those 5-alpha reductase inhibitors. They're going to be in there, which that may help your symptoms in the short term, but in the long term, that's not going to help you. Buy the most bioavailable forms of vitamins and minerals. Make sure you're looking at minerals that are orotate or chelated forms. Get whole food multivitamins. Buy organic, non-GMO foods and supplements, and lift weights. Do explosive training, do explosive sprints. Any of that sort of stuff is going to really help with your testosterone. And then check out my other video that's more in depth on testosterone boosting. And please subscribe to my YouTube channel. Remember the 3 pillars of health: eat well, lift well, sleep well. This has been another edition of Supplemental Sense.